Performance of Doctors Community Hospital. The presentation was prepared as part of HAP 725 course taught by Dr. Farrokh Alemi at George Mason University, Department of Health Administration. Brittni Beverly-Adams is a student in the Health Informatics Field, graduating in 2020. Source of data. The data used in this case study was from the HOS annual files from the Hospital Compared Data archive on data.medicare.gov. The years of the data that was used for this case study was between 2014 through 2018. Next, we will discuss the limitations in this case study. Limitations in the study include no available data for certain measures in 2014. For example, coronary artery bypass graft surgery, also known as CABG, had a lot of data that contained NA, which means there was no available data for those specific years. Another limitation from the case study was there were different file names for different years. As you can see from the screenshots provided, in 2017, the file name was Complications and Deaths, and in 2015, the file name was Readmissions and Deaths. Lastly, another limitation in this case study was the data was inconsistent with its measures. In 2014, there was not a measure for CABG. As you can see on the screenshot provided, CABG was searched and there were no matches available. Next, hospital competitors for Doctors Community Hospital. The hospital competitors for Doctors Community Hospital were Washington, D.C. Veterans Affairs Medical Center, Capital Excellence, United Medical Center, and University of Maryland's Prince George's Hospital Center. Competitors were picked based on location, services, and overall hospital ratings. A X-bar control chart was used to compare Doctors Community Hospital performance to its competitors. The first performance indicator was comparing Doctors Community Health performance for rate of complications and death for AMI patient, which also stands for acute myocardial infarction patient, with its competitors. This chart shows that Doctors Community Hospital performance was within expected rates of its competitors because all of the values for Doctors Community Hospital score were between the upper control limit and the lower control limit. The second performance indicator was comparing Doctors Community Hospital performance for rate of complications and death for COPD, also known as chronic obstructive pulmonary disease, patients with its competitors. This chart shows that Doctors Community Hospital performance was within expected rates of its competitors once again. As you can see, the observed values for Doctors Community Hospital score was within the expected values and did not exceed the upper control limit or exceed the lower control limit. Next, the third performance indicator was comparing Doctors Community Hospital performance for rate of complications and death for heart failure patients with its competitors. This chart shows that Doctors Community Hospital performance was within expected rates of its competitors once again. As mentioned previously, the observed values stayed between the upper control limit and also the lower control limit. The fourth performance indicator was comparing Doctors Community Hospital performance rate of complications and death for pneumonia patients with its competitors. We begin to see like a similar pattern as before. Doctors Community Hospital's performance observed values have stayed within limits and has not exceeded the upper control limit or the lower control limit as expected compared to its competitors. The fifth performance indicator was comparing Doctors Community Hospital performance for rate of complications and death for stroke patients with its competitors. The chart shows that Doctors Community Hospital performance was within the expected rate of its competitors because the observed values stayed between the upper control limit and the lower control limit. Lastly, the sixth performance indicator was comparing Doctors Community Hospital performance for rate of complications and death for CABG patients with its competitors. CABG stands for coronary artery bypass graft surgery. The chart shows that Dr. Community Hospital did not have any data points for CABG, and so therefore we were unable to compare its performance with its competitors. Lastly, the summary. In conclusion, Doctors Community Hospital performed as expected compared to other competitors overall. We can assume that Doctors Community Hospital has a similar overall rating as competitors expected. For example, looking back in the case study and reviewing over the previous charts, we saw that majority of the charts showed that all of the observed values for Doctors Community Hospital were within expected limits. If these values would have exceeded the upper control limit, then it would be expected that Doctor Community's mortality rate would be higher than its competitors. And if the observed values were below the lower control limit, then it would also be expected that Doctor Community's mortality rate would be lower than its competitors, which would be really great. Also, the quality of care is what competitors expected because the observed values stayed within the expected limits, and also all the scores except for CABG were within expected limits because we could not record any data for the CABG chart because the measures within the years from 2014 and 2018 were very limited with data. Thank you for viewing my presentation.